Upon entering the room, proper hand hygiene performed. Good evening, Daniel. My name is Jeff. I'll be the Jacksonville State Nurse Practitioner student examining you. Is that okay?
Yes.
How are you doing today?
I'm doing well.
Good to hear. So we're going to start with a cardiac assessment and then move into a lung assessment. Does that sound okay?
That's fine.
To do this assessment, I am going to need you to remove your shirt. All right. You can lay back comfortable. I'm going to turn the light on here and just examine. Okay, so we're first we're going to inspect the chest, looking for the precordium. There's no lifts or heaves noted. Apical pulse is hard to see at this moment, so we will listen for that later on. Okay. All right. So I'm going to turn the light off, and we're going to get you to lay back. For your feet here. Alright, so what I'm going to do is palpate your precordium. Pull my hands up here. Okay. Sorry, my hands are still a little chilly. Okay. And I can feel your heartbeat. It's roughly 56 beats per minute. I'm going to finish palpating here. Alright. No lifts or heaves noted. You can go ahead and sit back up for me. And I'm going to auscultate. I'm just going to take a listen to you. Listening at the aortic with the diaphragm. Just going to move to the pulmonic. Erb's point. Tricuspid. And the mitral. Okay, I'm going to listen with the valve. Same places. Aortic. The valve is going to hear lower sounds, lower pitch sounds, which would be indicate murmur. And we're going to go to the mitral. So some points that we were looking for would be the sternum here, the midclavicular line, axillary line, the apex of the heart should be here, and then this, of course, your sternum. And I'm going to get you to go ahead and lay back down, and we're going to listen to your mitral valve. Lay on your left side for me. I'm going to listen to your mitral valve, and this position helps us determine murmurs a little easier. Okay, things sound good. You can sit back up for me. S1, S2 heard. No extra sounds. No S3, no S4, no splitting, no heart murmurs. Okay, so now I'm going to go into the chest and lung assessment. We're going to note the landmarks here. The trachea midline. You got your suprasternal notch here. Your angle of Louis here. Your costal angles here, and then your apex should be here. Lean forward just a little, which should be right around the C7T1 in the back. So we got those. We're noting here for inspection, we're going to note chest expansion, which is symmetrical on both sides. Diameter was within normal limits, and no adventitious breath sounds, visual or vocal at this time. So we're going to go into palpation. I'm just gonna palpate, touch your chest and the backside, and just see if there's any areas of crevice, which would be like trapped air. All right, raise this arm for me. Other arm. Okay. And I'm just gonna do the back here. Okay, everything seems fine back here and up there. I'm just gonna put my hands on the back, and when I tell you to, I want you to take a deep breath. I'm measuring expansion of the thoracic. Okay. Okay, deep breath. And out. Good. Okay. So your thoracic expansion is equal, bilateral, and we're gonna go into listening for affirmatus. I'm going to place my hands here. I want you to say 99.
99.
Again.
99.
Again.
99.
And one more time.
99.
Okay, good. Affirmatus is felt, which is a normal finding. We are going to, from there, we're going to go into percussion. I'm going to percuss the front and then the sides, and then I'll percuss the back, okay? All right, listening for your sounds in here. We should be hearing resonance, which means healthy lungs. Good. Raise this arm for me. Okay. And then on the back, what I'm going to do is I'm going to do the same thing, but when I get to the bases, or I'm going to get you to hold your breath, and when I get to the bases, I'm going to mark it with some tape, and then I'm going to measure, and that's going to be your diaphragmatic excursion. And that, what that's going to do is tell me where the bases of your lungs are, okay?
Okay.
I'm just going to tear off my tape and have it ready. And we'll begin. Okay, so if you will, take a deep breath for me and hold it. All right. Place a piece of tape here. You okay?
Mm-hmm.
All right. You take a breath and let me know when you're ready. Good. I'm going to go back up. Okay. Put a piece of tape there. All right, breathe. Normal. And just let me know when you're ready. We're going to do the other side. You ready? Okay, breathe normal. Put a piece of tape here. Let me know when you're ready.
Okay.
All right, take a deep breath. Hold it. All right, piece of tape there. You can breathe normal. I'm just going to measure this. Okay, 3 centimeters there. And you're 2.5 centimeters there. And that is within normal findings. I'm just going to remove the tape, okay? I'm just going to pull just a little. Sorry. Okay, also assessing breathing pattern, I noticed 12 breaths per minute, and which is a normal finding. No accessory muscle used, okay? So now I'm just going to auscultate, listen to your breath sounds in each area. Deep breath. Out. All right, give you just a moment. I'm going to do your arms, under your arms. All right, you ready? Deep breath. Other side. Okay, and then I'm going to do the back. Again. And one more. Good. Okay, I'm just gonna listen on the front and I want you to say Mickey Mouse, okay?
Mickey Mouse.
Again,
Mickey Mouse.
again,
Mickey Mouse.
and again.
Mickey Mouse.
Okay. So with percussion, all fields resonant. With auscultation, all sounds are clear, normal breath sounds, and with the vocal resonance, it is heard muffled, which is a normal finding. Anything else you have?
That Bill.
Okay, thank you, Daniel.
Thank you.